Cardiomyopathy, or CM in cats, is a group of diseases where the heart walls, which are muscle tissue, either become thicker than normal or thinner than normal. In either form, the heart's function is greatly compromised, leading to eventual heart failure. Several causes of cardiomyopathy have been identified. However, we still do not understand the origin of many cases of CM. Cardiomyopathy usually takes several weeks to months to progress to a serious stage. Because many cats do not show signs of serious illness until the disease reaches a crisis, it may seem that a cat with clinical signs has only been ill for a few days. Inactivity and poor appetite are the first signs you may notice. Normally, weight loss follows. Cats with CM are prone to producing blood clots that often lodge where the blood vessels go to the rear leg. This produces painful paralysis in the rear legs. If the cat is treated immediately, circulation may be restored, resulting in the return of normal leg function. However, then the heart disease must be controlled, or the cat will continue to develop problems and die. The first test for diagnosing CM is a chest X-ray. If the X-ray shows a large amount of fluid in or around the lungs, the fluid may need to be removed so more X-rays can be taken for better evaluation. X-rays show the size and shape of the heart. Some cases may require better visualization of the heart with ultrasound. Ultrasound is non-invasive and allows visualization of heart function while the heart is in motion. Ultrasound also allows measurement of the heart muscle to determine if the muscle is too thick or too thin. An ECG, or electrocardiogram, is useful to evaluate the rate and regularity of heartbeats and to show abnormal electrical activity. Once a complete picture of the body's overall condition is assessed, the appropriate treatment plan can be recommended. Different drugs are used to treat the different forms of CM. Hypertrophic cardiomyopathy, or HCM, is the most common form of cardiomyopathy in cats. It is thought to be inherited in many cases, as it is often seen in cats younger than 5 years old. HCM-diagnosed cats should be prevented from breeding, and their litter mates should be tested for this disease with an ultrasound study. In hypertrophic cardiomyopathy, the heart muscle thickens, stiffens, and the heart chamber becomes smaller. Great stress is put on the mitral valve in the heart, causing it to weaken and leak. This leakage is heard with a stethoscope as a heart murmur and signals the need for other tests to determine the cause of the murmur. If HCM is diagnosed early, or if the congestive heart failure is controlled with drug therapy, many HCM cats can live for years. Newer studies with drugs in the ACE inhibitor class have shown that some cats have thinning of the thickened heart walls after 2 to 4 months of therapy, and heart function improves. Many of these cats return to normal health. If this occurs, the ACE inhibitor drug may be necessary for the rest of the cat's life to prevent recurrence. Restrictive cardiomyopathy, or RCM, also called unclassified or intermediate cardiomyopathy, stiffens and thickens the heart muscle in some places, but not in others, and inflammation is present. A heart murmur is also common in this form of the disease. Treatment is similar to HCM, but the prognosis is not as good. Dilated cardiomyopathy is diagnosed when testing shows the heart muscle is thinner than normal. This condition tends to develop slowly over a period of time. The clinical signs of heart failure may appear very suddenly. Treatment to control heart failure will be necessary for the rest of the cat's life. The long-term prognosis is not very good for many cats with dilated cardiomyopathy. Routine ECG screening may show telltale signs of the potential for some forms of cardiomyopathy up to 2 years before clinical signs develop. This allows preventive measures to be taken, which can minimize the effects, slow down the progress, or even reverse this condition in certain cases.